So what happens at the end of life? Here's a paranormal phenomena that happens to almost everyone at the end of life. We're going to be talking about visioning. Visioning is an actual sign and symptom of death and dying. It happens to almost everyone. It happens so often that we actually put it in our educational books to educate patients and their families to expect this. So what actually is it? Visioning is when people who are dying will start seeing their dead relatives, dead loved ones, dead neighbors, friends, pets, anyone who has brought them comfort in their life. They will actually start visually seeing them, sometimes even having conversations with them. So to be clear, medical professionals do not know why this happens. However, I have to talk about it because it happens so much. It is so normal. It's literally a normal part of death and dying. Many people in the comments, I'm sure, will say, oh, it's because they're having hallucinations. It's because they're on so many medications. It's because they have lack of oxygen to the brain, so they start seeing things. Let me tell you this. We don't know why it happens. I don't know why it happens. But what I can tell you is it is not those things people always think it is. How do we know? Because as medical professionals, we do see what hallucinations look like. We do see what psychosis looks like or delirium looks like. We do see what low oxygen to the brain looks like. Visioning looks nothing like that. First of all, visioning usually happens about a month before someone dies. So the person who is dying is usually alert, oriented, eating, walking, talking, living kind of a normal life, and then will start seeing their dead relatives, their mom, their dad, and be just as confused as everybody else, just as surprised as everybody else. They're not confused in seeing them. They're not like barely breathing and seeing them. They're usually very alert and oriented and seeing their dad, who has been dead for 2 years. And they will actually ask us as medical professionals, like, hey, what's going on? I've had several patients, literally countless patients, come up to me privately, and almost sheepishly say, I don't know what's going on, but I keep seeing my dad before I go to bed. He comes to me. He says he's coming to get me soon and it's all going to be okay. What am I supposed to make of this? And I have to tell them that, well, one, I don't know, but two, it's normal. So this idea that someone is very confused or almost at the end of life and then they're seeing these things is just not true. Visioning happens like a month usually before someone dies. And it's actually a signal for us as healthcare workers to think, okay, they're now starting to vision. They likely have about a month to a few weeks left. So there are some people who can still have visions and visioning and be confused, just to be clear. Not everyone is always alert and oriented when this is happening. There are some people with dementia who already have like baseline confusion that still experience this visioning phenomena. The main point I'd like to say about the visioning is that it's always comforting. If someone has baseline confusion and starts seeing their neighbor who died 10 years ago, but the neighbor is harassing them or making them feel scared or paranoid, that is not visioning. That can be part of the disease process that they're going through. Visioning is always comforting. And also, like I said, we don't know why this is happening. I'm not necessarily saying they are literally seeing their dead loved ones and that means there's an afterlife. I don't know. Maybe it's actually because our bodies are built to die and the body knows it's dying, so it's making these things happen to give us comfort. Either way, to me, it all feels magical. Either way, no matter what the reasoning is, I think it's amazing that most people experience this, and it doesn't necessarily mean anything, but the fact that most people have this comforting thing that happens to them at the end of life is amazing to me, and I want people to know about it. Here is what visioning is not. Visioning is not low oxygen to the brain. How do we know that? Because the person telling us that they're experiencing these visions is not having low oxygen to the brain. We can check their oxygen, they're fully alert and oriented, and they're not showing signs of hypoxia. It is also not the medications or the morphine or over sedation. And how do we know that? Because again, most people who are having these visions are not on a lot of medication or have been on several medications for a long period of time and have never had visioning before. Not all medications equal hallucinations. So visioning is specific to end of life. A lot of people think that near-death experiences are the same as visioning, and they are not. And the difference is near-death experiences is usually people die, have some kind of experience, come back and talk about their near-death experience. Visioning is specifically for people who are still alive and near the end of life, and is actually a sign of death and dying. It is something that healthcare professionals who work in this world look for, so we can actually gauge how far along this person is on their death journey. So this is one of my favorite facts to tell you about end of life, and I do consider it a fact. Most people experience it, and it always brings people comfort. So if you have experienced this, please tell me this in the comments so I can go back and read it and share your stories. Something different about this video is I'm going to make a follow-up video talking about the stories in the comments. If you've reached the end of this video, I actually have a question for you. Do you think your animals have end-of-life visioning? Have you experienced this with your animals? Let me know. Don't forget to subscribe for more death and dying phenomena.